Hello, my name is Michelle Yodrick. I'm a student in the Master of Arts in Clinical Psychology program at West Liberty University. I'd like to thank you for taking the time to watch my video. I'm going to talk about becoming a behavioral health professional in West Virginia. I am part of the way there and I still have some steps to go, so I'm going to talk a little bit about that. But first, I'd like to talk about the need in West Virginia for more behavioral health professionals. So the average prevalence of past year serious thoughts of suicide was 5.6% in 2017 to 2019, which is higher than the national average. Also, the opioid crisis in the US has particularly affected West Virginians. 70% of drug overdose deaths in West Virginia are from opioids. So there's a huge need for behavioral health services. However, 51.6% of West Virginians in 2019 did not get behavioral health services, even when they did have serious issues. So that could also include depression, anxiety, any OCD or grief or anything like that. And this statistic has likely gone up due to COVID-19, which has limited the availability of services. And that's a problem because in West Virginia, there were already so many areas that were underserved in behavioral health. So there weren't agencies or professionals within a decent commutable distance for people, especially for people with transportation issues. And so it's very important to kind of grow the field, and hopefully I will be a part of that. So first of all, every part of the journey is important. We all start somewhere, and back in 2015, I entered the undergraduate program in psychology at West Liberty University, where I still am today, only in the graduate program. So I was thinking about what do I want to do? And I picked psychology because it would allow me to one day become a therapist after graduate education. So I thought, let's start somewhere. I really wanted to be able to help people and work one-on-one with people. So I graduated from the undergrad program in 2018. I entered the graduate program in clinical psychology in 2019. And I have since become a graduate teaching assistant. So the bottom left is actually the most recent picture. That's me teaching a class of undergrads. It has been a really, really great experience to go from being a student to teaching other students about the field and mental health. So that has been a very rewarding experience. So tell you about my undergrad journey, I had to learn a lot about the field of behavioral health. I was passing classes, I got some practica. So those are jobs through the program, and I passed a major field test. Now, psychology is not the only way to go about working in the behavioral health field. That's what I did. There's also counseling and social work that help fill our state's need for behavioral health professionals. So after undergrad, I entered graduate school, and that involves, the same thing like passing classes. I actually just recently passed all of my coursework, and I'm a practicum student. So I am working in our own school's behavioral health clinic. I am being supervised about the treatment that I give to my clients, and I'm preparing for internship in the fall. So that will be an outside agency in behavioral health where I'll also get to work with people. I've begun studying for the licensure exam. So licensure basically means that I will be good to practice on my own. You can also get licensed in clinical social work. I'm going to get licensed in clinical psychology. So that involves getting approved by the Board of Examiners of Psychologists. And I'll have some extra supervision time, and then eventually I'll be on my own in the field. I wanted to talk about how I did that because it can be different depending on what you want to do, but it's just an example of how you can do it. I also had this quote here from Maya Angelou: if you find it in your heart to care for somebody else, you will have succeeded. Most of us enter the behavioral health field because we want to help other people, and this is a fantastic way to do it, to help people with a diverse variety of needs, and hopefully we can provide for our state better by becoming behavioral health professionals.